I mean, I'm excited about the fact that I will actually be one of the people who gets to help someone be more happy with their life. Yeah, I'm definitely very happy with the program, very happy with psychology. Well, it starts out the first year, we pretty much do all classroom work. We learn about different theories of psychology and, even do some improv work to help us get comfortable just being able to spontaneously talk. We learn how to give and score psychological tests. We learn, basically the different types of therapy, whether it be family or individual or, couples, career. Then we also are able to work with our professors on projects that they have going. The second year, we are split between doing coursework and doing what's called a practicum. Like I went to an inpatient hospital, and we will give psychological tests the entire year, give them and then write reports, do assessments, interpret the tests. The third year, we again are doing coursework, and now we are doing therapy in a practicum setting. And also right now we are applying for internships, which is our entire fourth year. We work full-time in whatever kind of setting that we want to. One class is called the core class, where all of the first year students on campus, the DOs, the pharmacy, PTs, all of us are in the same class together. And each week we kind of learn about what they do and how they connect. I think some of the advantages of having that kind of interdisciplinary team is that it opens your eyes to, other things that might be affecting your client. There's a small enough program that we all can get individual attention from the professors. We get to know them, they get to know us. They teach, 1 day a week or 4 days a week, and they also all practice in the field. So they have either a private practice or work at a hospital. So it's nice to bring in the real world current examples. A lot of the faculty, I think almost all of them, are doing research in some capacity or another, and so pretty much any interest you have, you get to do it. And also the fact that we have to do a master's thesis here, which is kind of unique for Psy.D programs. It lets you do your own research and possibly get published or get recognition, which is pretty cool. And then also it's nice being on this university because we have a lot more opportunities with just the medical equipment. So it's definitely not just a lot of theory, especially being, a Psy.D program. There's a really big emphasis on getting out in the field and doing the work so you know what it's like. The faculty prepares us very well for, interviews and how to present yourself well. They give you enough experiences, and so far we've all, done really well in our placements. Definitely unique because I came from a very large undergrad. So to come to a class of about 20 people was kind of a shock at first, but even in a field that's so competitive, it's been so refreshing because everybody, is willing to help you out, and then also, you get to know each other so well that you're comfortable in class to just say whatever comes to your mind. We get together socially, and living on campus, you definitely get to know each other very, very well. The faculty kind of take the approach that we're not going to let anybody fall behind and want us all to develop in the way that's natural for us. So they're going to give us the individual attention to let our natural talents grow, and then also make sure that we're competent in the areas that we need to be competent in. And from the very first class, they said this is something that's emphasized on the licensing exam, and they've been doing that the entire way along. So we're getting a chance to build up our knowledge that's going to be necessary when we do sit for licensing. I think it has allowed me to take something that I had an interest in and allowed me to grow professionally, intellectually, and personally into, the person who I am now, who I'm more comfortable with myself and my skills, and also comfortable that I actually am in the right field for me.